Thanks, Julia. Yeah, and you all should have just gotten that message. So like Julia said, we'll be recording tonight and it'll be posted on our YouTube channel. So if you don't wish to appear in that, um, please just keep your camera turned off. And thank you. Joanne just launched a poll for you all if you could fill that out. So thank you for joining us and welcome back to our regulars. We were just saying, I think some of you have been along this journey with us for a while and come to a lot of our chats. So thank you. We're just a couple more logistics. We're excited. We're now offering live transcription and captioning for our chats. So you can click the live transcription button on your Zoom menu to turn that feature on or off. And I'll put that information in the chat as well. So tonight's format, we will begin with a presentation from Julia. And then have a little mini question break, shorter than we normally do, because then we're really excited to get to hearing your concerns for students this fall. So during that section of the program, if you can please use the raise hand button in the reactions menu on your screen, and we'll call on you that way to hear your concerns. And just again, like Julia said, we ask that you please remain muted until you're called on. So thank you.
Great, so I will get underway. Hopefully these are the right slides. From beginning. Oops, already blew it. So we're going to try to go somewhat quickly. Probably most of you know that every school district, every school is supposed to be fully in person, whether they're opening in August or in September. Full-time, 5 days a week. We're going to go over what the health and safety protocols are that are currently in place, although it's certainly possible things could change by the time schools actually reopen. The CDC and the state have said districts should certainly continue to implement physical distancing to the extent possible, but they've been very clear that schools need to stay open. So if it's not possible to keep 3 feet or 6 feet apart, then it is more important that schools stay open at this point, given where we are in the pandemic and where people are with vaccination levels. There's been a lot of discussion nationally as well as our state about whether or not masks are going to be required in schools in Massachusetts. Currently, at this point in time, whether or not students in your school district are going to have to wear masks is a local decision. The state is not currently requiring that all schools require that everybody, whether they're vaccinated or not, wear masks. Obviously, this has been a big issue and concern nationally, particularly since many children are not old enough yet to get a vaccine, as well as the fact that not everybody is vaccinated, either students or educators. There's been a lot of controversy about this. As you know, there are other parts of the country and the CDC is recommending that masks be used. And nobody knows if it's going to change in the state. There's a lot of pressure from some of the lawmakers for the state to require that everybody wear masks. But currently, that's not the requirement. It's, I think our state thinks that each community will know best what the level of infection rates are of COVID and the variant in their own city or town, and they can make their own decisions. There are some districts that are already requiring that students and staff always wear masks. The state has said that masks for K-6 are strongly recommended when individuals are indoors. And of course, that masks for unvaccinated staff and students are strongly recommended. Masks accommodations due to medical conditions or behavior or disability are still required, those accommodations, regardless, whatever the policies are that end up being in place. Just as a little PS, under the federal public health order, masks are still required on all school buses. The other thing that is going to be a little bit different in the coming year is what's in place in terms of COVID-19 testing and the contact tracing and quarantine protocols. As you may know, the state has been offering districts for free who want to participate access to both pooled testing and now to individual testing for whether or not somebody the antigen test will be available. And the state's been very clear that for those students whose families want them to participate in the pool testing or in the individual testing, that accommodations need to be provided for somebody based on their disability, what they need to be able to participate in the testing that's available. The thing that's going to be new this fall is in terms of quarantine. The details have not yet been released, but there's going to be the state has said there's going to be a test and stay protocol, so that if somebody is exposed to somebody with COVID in school and they're asymptomatic, they can choose to go home and quarantine, or they can stay in school if they're tested daily with the COVID diagnostic test, individual diagnostic test, for at least 5 days. So that's going to be very different. We know for a lot of students, it was very disruptive to be exposed, asymptomatic, be home for a couple of weeks and then come back. So this will be an option. The details are supposed to be released soon about how these new protocols will be implemented. So the thing I hope most families and advocates know at this point, but the big thing that's going to be very different in the fall, since all the schools are going to be fully open, is it is no longer going to be a parent choice about whether or not they believe they want their child to stay home for their own, and continue to have the option to have fully remote learning. That was an option through the summer for families, but it was no longer going to be an option. So if your family, or you're working with families who believe that because of the child's health condition or the health condition of other family members, that it continues to be important to stay at home with fully remote learning, then currently the only way to access that kind of remote and that home instruction is through the home hospital services that have existed long before COVID. So we're going to try to very briefly just go over what those two options are. There's two different forms that I think Lily is going to be dropping into the chat, that for all students, non-disabled or not, if there's a physician's note that says that the student is likely to be out for 14 days or more for medical reasons, then the child has a right to continue to start to receive services in their home. For students with disability, and if the student has a disability, then they do need to look at how to implement the IEP during that period. For students with disabilities, if the doctor writes a note on the form that Lily is providing that the student is likely to be out for 60 days or more, then the school district has an obligation to immediately convene the IEP team and determine whether or not there's going to be any changes needed in the IEP to fully implement their IEP in that period. So we want to make sure that obviously it's for all students for whom it's appropriate. It's going to be really important to be in school and take advantage of classes being open full time. But we know that there are situations where that may not be possible, and we want to make sure that families know about these options. We have gotten calls on our helpline about if there's a sibling who's immunocompromised or other family members, how do they handle that situation? And what the state has said is they have strongly encouraged schools to work with families and to figure out a way to accommodate the student if they need to stay home due to the health of other family members. So there's no specific procedures in place. Our advice would be, if that's the case, is to get a doctor's note. You can even use these same forms and explain that it's because of the other family member that this particular student needs to stay home. The range of services, typically pre-COVID, home and hospital services, whether it was actually legal or not, were really usually very limited, a couple hours of individual tutoring a day. The state guidance around this option, whether if a student needs to stay home for medical reasons due to COVID, has made it clear that it can be one-to-one or small group instruction, but it also can be the live streaming or remote learning that we now know is possible And it's been, a lot of the kinks have been worked out, obviously, over the last year and a half. It's very clear that the number of hours and the time of day and all of that needs to be based on the educational and medical needs of the child. The IEPs still are going to need to be implemented. And, there's going to be a lot that needs to be addressed. And we're obviously hoping this goes smoothly for the smaller numbers of families who may need this. We want to very briefly touch, I'm looking at the time, on compensatory services. We've talked a lot about that in the past. The one thing we did want to flag is that the state's newest guidance in their frequently asked questions that Lilia is, I think, going to be dropping into the chat, makes it very clear is that hopefully school districts have convened 2 team meetings, if that's what's needed, to figure out whether or not your child needs and is entitled to compensatory services because of COVID. They might have a right to compensatory services for the spring of 20 after the school shut down in March. And they might have a right to compensatory services for the last school year. I can't see what I'm at. Am I on the wrong slide here? No. And so the state has said that if those team meetings have not been held, then the school district has an obligation to convene them as soon as possible. So this is, again, really important because we know from some of the families we've been hearing from that they have not yet had an IEP meeting to determine whether or not their child needs compensatory services. So this is kind of complicated. I'm just going to go over this very briefly, but there's supposed to be an IEP team meeting for every child with a disability to figure out whether or not they should have, whether or not they needed compensatory services for the period from spring of 20. If a child or family feels like they might need compensatory services for the last school year, the second group, any family who requests an IEP meeting, then the district has to convene one to discuss compensatory services. But the state has also said that there's certain students for whom the district really has an obligation to convene the team and figure out whether or not they need compensatory services. For example, in districts that were fully remote for 3 months or more over the last school years, or students who are chronically absent, or who had a lot of difficulty accessing remote learning due to their disability. And as you know, the parent input about how your child did has to have a lot of weight as the IEP makes its decisions. And then the last thing we wanted to flag to you is there was a new guidance issued by the state around really emphasizing what districts need to be doing to facilitate student and family engagement in the coming school year. They've reiterated a lot of the things that we've talked about in the past, that districts have to figure out a way to have culturally and linguistically appropriate two-way communication to get parents' input. We know a lot of students are going to be returning for the first time this fall, and they're going to really, schools are going to very much need to partner effectively with families. The state has emphasized very clearly that any kind of exclusionary discipline has got to be a measure of very last resort. We know many students have increased mental health needs and behavioral challenges and have experienced trauma as a result of what's been going on with the pandemic, as well as with the George Floyd police murder that many members of the Black community have been experiencing. And the state has made it very clear that alternatives to exclusion are things that have to be implemented and considered. And they've really emphasized how to provide the kind of mental health and other supports that are going to be important to include students effectively as they return to school. So that's a very brief overview before we open up for some questions, and then really want to hear more from you about what your concerns are about the coming year. Are we on time?
Mm-hmm.
So if there's any questions, I guess I should stop sharing, right? So we can see.
So we have a question in the chat, which is, can schools request that those meetings be held remotely only? I think this is in reference to Compensatory Services meetings. Correct me if I'm wrong. That one's from Salima.
Yes, again, as everything that school districts have said, even during the height of COVID, parents weren't required to have an IEP team meeting remotely, but it's certainly something that school districts can continue to offer. And I think, as again, there's a strong desire to sustain social distancing as much as possible, at least given how the pandemic is now. But they cannot require a family to participate remotely. So currently schools are fully open. That's my understanding at this point. That's a good question.
Yep.
And I think even as the pandemic disappears, which is going to happen sometime, right? I think that we can expect that remote team meetings will be an option that a lot of some families will want them and some won't, but I think it's going to be an option that's going to be much more available.
Thank you. We have another question from the chat, and I just want to remind people you can post your questions in the chat, or you can ask them verbally by using the raise hand button in the reactions section of your menu. Our next question is, I'm wondering how parents might begin to think about the creative ways to provide compensatory services. Do you have any resources you can direct people to?
That's a great question. I'll start and Janine jump in with anything that you can think of. And when we're representing individual families, it's something that we, think about. And the ways we approach that is, first of all, we try to identify what the need areas are, and brainstorm both with the family and also encourage the family to talk to any other service providers that might know the child and might have ideas about what appropriate compensatory services might be during the summer or after school or on the weekend, or for older kids, possibly extended time beyond when they exit special ed. But the child's pediatrician or their therapist, or if they have their own ABA provider, we've often gotten some good suggestions by just looking at the pool of people in the community that know the child. But I think people should share their ideas in the chat as well about those kinds of creative solutions that might be possible. Janine, do you have any other thoughts with that?
Yeah, no, just I think some of it also depends upon the age of the child, as you were saying, so that compensatory services for an older student, for example, that might look different. Some of the services I got for a student, for example, had to do with extra coaching that student needed in college. So that's an example outside of the actual school building. But Julia's right, it's really a range. And so I just think it might depend on the age of the student in terms of the location of where the services are going to be or what they might look like.
Exactly. Those are really important points. One thing that we've talked about with several families as well as practitioners is there's certainly children with autism and other types of disabilities who require compensatory services to address their inability to get the kind of social skills group and speech therapy, really focusing on social communication that they needed. And so some of the compensatory remedies that are being discussed and pursued are providing the specialized services in an after-school setting or in a community setting, some way to really address the particular gaps that resulted from a lot of the isolation that students experienced. I hope we're going to see a lot more partnering between the community, the learning pods, the after-school programs and other programs, and the schools. We're hoping that that's something that really gets better coordinated in terms of accommodating students with disabilities as we look at compensatory and other remedies. Right. Well, I'm wondering if we should maybe just do one more question before we switch to the rest of the.
Sounds great. So our last question is, for children in special education schools that don't have counselors on staff, are they required to provide mental health assistance?
That's a really great question. So are they talking about private schools? There's two different kinds of private schools. There could be a private school that's
it's a private special ed school, which my son is just starting, this fall. We got him into that school because of all of this. It's actually, yeah, it's White Oak in Westfield. So I think they're looking into getting counselors, I hope, and I'm going to be pressuring them to do that.
So I think a really good question. I think everything ends up being, and you don't have to answer, but some students are placed in a special ed school by the school district, and some parents privately place their child there. And either way, if your child has an IEP, then what the IEP team for all kids, what the state has said really clearly is that there's three kinds of support that they might need to address their mental health needs. That all school districts are going to be providing what they call recovery services, which are a lot of services that the state's been trying to increase the capacity of school districts so they have more services to address the increased mental health needs that result from the child's disability. And so those are services that your child, I think legally, whether they're in a out-of-district school or an in-district school, if there's mental health services being offered to the general ed population, then those are services that have to be equally available to your children if they have disabilities. So there may be general ed mental health counseling and other services that your child should be able to access, even if they're in an out-of-district program. And then the state has said really clearly that IEP teams, when they meet, or you can ask for an IEP team meeting, they need to address not just whether your child needs compensatory services, but whether they have new needs that need to be addressed. And they were very much thinking about that there's going to be some children who have new mental health and new behavioral health needs that are going to really require additional services going forward. So you're going to have to both look at, I think, through your own individual child's needs, as well as through what's being offered.
That's a good point, though, because his whole IEP has to be rewritten. The whole thing. I mean, it's all going to be different. So he has to have an IEP meeting anyway. So hopefully at that point, I'll know if he has. He's never had any issues in the past, but because of the isolation, I mean, it's like a year and a half of
Exactly. And that is, I think, there is some, and we, Lily, did you drop down that new guidance about parent engagement and student engagement? Because Michelle, I would suggest you really look at that, because they talk a lot about how to address the mental health needs of students. So there's a lot of strong, there's going to be a lot of financial resources and other resources, but it doesn't mean that those kinds of supports are necessarily going to trickle down to your child when they need them. So it's great to be thinking ahead of time about how to start advocating for that.
Okay, great.
And those are really important questions. And so I think, Lily, at this point, I want to leave enough time to talk about the next tab. So if you have questions that we aren't able to answer, please feel free to write to our helpline or call our helpline. I'm sure that information is going into the chat. And I'm sure some of the questions will come up in this next piece. So what we want to hear from you is, as you think about the coming school year, what are your primary concerns and worries about your own child or the kids that you work with? And Leah's going to share her screen so that we can kind of pretend we're in person and there's a big piece of paper and we're writing things down the way we used to in the old days, but we really want to get a sense of what are the concerns that people have. And first, that'll help us figure out how to shape our future chats going forward. And also, perhaps we can address some of those concerns as we hear what they are.
Great. And our first participant, once Lily puts her
there we go.
Screen up. You just let me know. Are you ready, Lilia?
Yes.
Okay. Salima, you want to go ahead?
Yes, sure. Hi, everyone.
Hello.
So I guess my first concern is the fact that when students are going back, school would start testing, and they always do that initial testing that they do. And they would just, be more concerned about getting those kids, like pushing academics on kids rather than thinking out of the box on how they can remediate to the loss, that came from the pandemic, and how they can also make sure that school presents itself as a welcoming place rather than, hey, you're here, okay, well, we're gonna get you smarter by all means. So I guess this is really my worry right now, guys. I really worry about that push that schools have the tendency to do in ordinary times, and even more so now.
Thank you, Salima. So you can see how we're trying to capture this. Did you mean focusing on testing and academics instead of making up for learning loss, or instead of first, or were you saying instead of first focusing on the mental health needs and emotional needs, or did you mean both? I want to make sure.
I meant both. I meant both.
Okay.
Yeah, I meant both.
Is there a way to see, again, we're all doing this new technology, but just by a show of hands, how many people share that concern about your child? I mean, you're worried about whether or not some people may be worried about the reverse, and is there a way to see that?
People can raise hands.
Yeah,
there is a way. Yeah.
Can you go out 1 second, Lily, and then come back in so we can see how many people raise their hands?
Yeah. Second. Oops.
So about a third of people have that concern. That's helpful to know.
Yeah.
The one thing in the state, somebody said they may not have seen it, but the new state guidance on engagement, if that hasn't been dropped in the chat.
It has been.
It has been, okay. I think that does also, Janine, doesn't it also focus on the need for schools to reach out, to connect emotionally, to make sure that kids are able to be receptive to the testing that's going to happen, and also just the focus on academics. You don't want to leave some kids behind because there hasn't been that time to really engage effectively and have people process whatever this difficult transition for many.
Absolutely.
Even the ones that have been in school are going to have a difficult transition possibly, and some students haven't been back at all. I'm sorry, what were you going to say, Janine?
No, I was agreeing. Absolutely. It's definitely covered in the new guidance. And it is just, they really covered it, I think, quite nicely to just really show that focus now. And
right.
That really not wanting to go back immediately to how things were because of the stress that kids have been under. And so.
Right. Can we get you back, Lily, on our?
Yeah, just give me 1 second.
Does anybody else have anything they want to share in terms of what they're most concerned about in the coming school year, or worried about how it's going to be addressed? I saw some hands before, but.
So we have one in the chat. I'm concerned that the schools will be more concerned about pushing kids through, even though they're not academically ready for the current grade level.
So being concerned that, like, if they're entering 5th grade, they're going to be so focused on making sure the child does everything they need to be able to be promoted to 6th grade, that they won't address the learning loss that occurred from the last period. Is that correct? Am I getting it right?
Yeah, just quickly moving them on without, so I guess, yeah, again, not addressing the learning loss.
Again, I think these are probably concerns that are shared by others as well. And it's not that if you ask for an IEP meeting, it's going to happen immediately in the first few weeks. But if that's a concern that you have, it would seem to be, and Janine, I don't know if you have another thought, that I'm asking for, even if it's not time for your annual IEP meeting, you could ask for an IEP meeting to really address that concern about how your child isn't academically ready. And then at the IEP meeting, you could talk about And believe me, there's going to be non-disabled kids who aren't academically ready. There's going to be a lot of kids who aren't academically ready. But then you, as a part of the team, could figure out which of the kinds of supports that are going to be offered to all kids might be helpful for your child in terms of whatever area they're not academically ready in. And you can discuss whether or not there's additional special ed supports or some kinds of time and accommodations they need so that they can accelerate and catch up. But you want to make sure your kids can access things that might help them that are being offered to everybody in the school in the district. And you also may need things that are more individualized to your own child's ways that they're not academically ready.
Yeah. No, I think that's a good suggestion.
So there is another question in the chat. And so they're asking, I want to know how the kids will be educated for at least 5 days if a family declines testing. Will the kids just go uneducated for the week? If so, how does the school plan to make up for that and to honor legal fee?
So the question is, if somebody is quarantined, I think is what they're saying, if they don't want to stay and be tested, how will they access learning while they're either quarantine? That is a really good question. We've been doing some advocacy at the state level, trying to get an answer to that question. And I do not think there is guidance yet from the state about how districts should be dealing with that. My suggestion is, and we'll certainly share with you as soon as there is information, if there's some policy about how students who do need to quarantine can still access learning. But I would just encourage you to do the kind of advocacy I'm sure most of you already do for your kids, which is just to advocate at the local level to have, there's going to be other kids who are in that same situation. And the teachers don't want the kids to be falling behind. So hopefully there will be flexibility around how to provide the supports they need to not fall far behind. I wish there was a better answer, but I know the state has not yet taken a position on that.
Thank you. This parent is concerned about masking. Her son is 11 and not eligible.
Got that written up there. I was just going to get to that.
Oh.
So I'm not sure if that question means they're concerned about that they want their child being masked or that their child is not going to be able to wear a mask if it is required. I'm not sure what
Or others being masked as well or not.
So you want masking of your child, but of the other kids too? Is that the concern? So as you saw at this point, there's not a requirement like there is, except in a couple cities and towns so far, that everybody be masked, whether they're vaccinated or not. So I know that there are many parents who are very concerned about that when their kids are the age where they're not vaccinated. The state's strongly encouraging it for kids who are 11, but they're not requiring it. And that's making a lot of parents really understandably very uneasy. Whether or not there's a chance the state is going to change its position by the time schools open. They certainly have in other parts of the country, and we don't know yet what's going to happen. But I think I'm glad this person raised that concern, because we know many families are concerned about that. Very understandably.
So do you want me to continue reading, or are you just going to read off?
Well, if they're already cut and pasted here, I don't think we need.
Okay. Yeah. Go ahead.
And we'll still also take anybody that raises their hand, but we'll just go through the list.
So somebody's raised a concern that a learning disability will be ignored for too long. So one thing that's important to know is that if you are worried that your child, if they already have an IEP, but it doesn't address something like a hidden disability or something like dyslexia, or you know kids who are not yet in the system, I think that's a very valid concern, that there's been a big push in our state because of a state law to make sure that kids with dyslexia are identified early and get the services they need as quickly as possible. And I think, of course, this is a really valid concern, because so many students are going to be behind. There are very specific screening assessments and other assessments for kids with dyslexia that schools are supposed to be implementing even as they're dealing with all the recovery needs of students. So I think that's one thing that parents and advocates can do, is to make sure that those best practices for identifying dyslexia are implemented, and we can provide more information about that at another time, or if somebody wants to contact our helpline. The other thing, and Janine, you may have other thoughts, is but to know is if a parent makes a request for an assessment to determine whether or not a child has a learning disability like dyslexia, the school district has to comply with the timelines from the time the parent asks. So if you ask, they can't say, let's wait, everybody's behind. If you make a formal request for an assessment to determine whether or not your child has dyslexia, then they have to, within 5 days, ask the parent for consent, and within, God, I just blanked, 30 days, finish the testing.
Yeah. And then have a team meeting.
Right.
So, right. So the timelines have been, and right now we're back on, and have been since schools reopened.
So the next question or concern is about compensatory services. There is so much confusion, not just among parents, but among attorneys and advocates, let alone special ed directors, because right now there's 2 different years. So if you came to an agreement about compensatory services for the spring of 20, or even if you came up to an agreement from the spring of 20 up to February of 21, that agreement is in place. But if you believe and the team ultimately determines that your child has a need for compensatory services for the time after the date of your agreement, then school districts are supposed to be conducting those IEP meetings. This compensatory services at a district, in this place, I assume BPS is Boston Public Schools, is allowing, they're supposed to be providing whatever services are necessary to meet the needs of an individual child. I know that a lot of times they offered more limited options, but I don't know if I'm answering the question clearly enough, but there's going to be, it's possible to have 2 different agreements, one for the time period that you already addressed, and then if there's your child is entitled to compensatory services for time after that, then you can raise that with the team.
Right.
Do you have something to add to that?
No, just the importance of getting the team to convene in the beginning of the fall, just like the guidance suggests, and getting your meeting scheduled. But it's certainly what you had said, the services need to be individualized. They really should not be, what they have to offer.
This next one is talking about the impact of the isolation. I'm not sure what RLA is. Does anybody know what 3 difficult months in RLA? Remote learn. I don't know what RLA is. Anybody know what RLA is?
Remote Learning Academy. It's parallel school that was going on.
Yeah, the virtual, yeah. There is there a way to argue that this year is different in terms of being retained for the year? I know that the state policy has been pretty clear, really discouraging retaining kids, because many kids are going to be are experience, like we said, this impact of the isolation. And their hope is that by providing the robust recovery services and other services, that kids will address not just their social and emotional mental health needs, but really in an accelerated way address their learning loss. So I know we've heard from families too who really believe that it's better for the child to repeat a year. And I think there's not I think some families have been successful, some haven't, but it's really going to be an individual determination by your principal and your local educators.
For sure.
Can you opt to keep your child virtual? This maybe I wasn't very clear, and you may have also come in late, but this year the answer is no. If a parent wants or believes that for health reasons your child needs to be learning virtually, then the only way to do that, and we'll be sending these slides around, is through a doctor filling out a form about the medical need for the child to be out for 14 days or more, or 60 days or more, depending on which system you're going to use, to make a long story short.
And I think, Lilia, were you going to drop some of those forms in the chat as well?
Yeah, I just shared
Yes.
those again.
So those are the physician forms that need to be filled out for those requests. But it is more specific.
Who conducts the IEP meeting if the child is in an out of district placement and no IEP was completed before the end of the school year? It's ultimately your home school district's legal obligation to make sure that all the parts of the special ed law are complied with. You typically in an out of district placement, there is a member of your home district that attends the meeting that's convened by the out of district placement. I mean, it's usually the team is everybody at the teachers and the therapists from the out of district placement, and there's a member of the home district who attends that. So, if the IEP team was supposed to meet at the end of the school year and they didn't, I guess what I might advise is that you make it clear to the home school district as well as the out of district placement that that's a meeting that should be convened, immediately when in the beginning of the school year, or, if they're out of compliance, if this was an annual review and they missed the time for the annual review, that will give even a stronger legal argument for the need to do that immediately. Janine, any thoughts on that?
Nothing that I can think to add from what you just said.
A concern that families are going to be a very valid concern that there's a lot of families asking for evaluations and team meetings. In fact, we've been talking about reasons that families might want to, and that the compensatory services will once again be delayed. I think that's, again, a really valid concern. I think, we also have in the end of our slides that if a school district didn't convene the compensatory team meeting that they should have last year, we always encourage you to first try to work it out with your team leader and your local special ed director. But if you can't, and if time is of the essence and they're not responding, that is a really appropriate time, if you wanted to file a complaint with the state at the problem resolution system. And we have that link, or maybe we can drop it in there. But there are a lot of letters of finding that have been issued by the state since COVID for parents who have filed complaints, and they not infrequently do require that compensatory services be delivered. So that is another option to be aware of, but hopefully with this new state guidance, you won't need to go that route. It is 8:45. We're going to stay here till 9, but we know not everybody wants to necessarily stay so late. So we will be meeting again in September. We may have more information, and we will certainly know how schools have opened at that point, whether the rules have been changed or not. But we would really appreciate also, as you leave, any ideas you have about topics that you think would be useful in the fall for us to focus on in our chats, whether or not this way of doing things is a good way or not so good in terms of trying to write things down. We're trying to find out the most effective way to meet your needs as we go forward. We know there's still uncertainty as much as we hope things would be more certain for the fall, at least right now, things are on a more shaky ground than anybody had hoped. So we really need to hear from you how we can best support you. So we'll keep going till 9, but thank you so much for all of you who did come.
I just want to share, there's a real concern here about not having remote as an option. And someone shared in the chat that Westfield and / Western Mass did offer virtual school for K through
It's,
8. Not sure if other districts.
hi, I'm sorry. I just want to make it clear. It's actually and it was in the spring, they actually created an actual virtual school. So it's not a virtual offering per se. It's an actual school you have to apply to. It's a K through 8 virtual school. So it's literally a Westfield school, but it's virtual. So I just thought if there is some people that were asking about the virtual, if they're in Western Mass, I don't know if there's still room, but it's out there. And I don't know if any other districts have done it, but.
That's a really good point, Michelle. There are 2 statewide, 2, right, Joanne, virtual schools, and then some districts, not as many as had thought they would in the spring, because it's a lot of work to set up a virtual school that's, you know, within the district, but some schools are offering that option. Very few, but some are. So that's a really good point, Michelle.
But and just to be clear though, if you have to live in Westfield to attend that Westfield virtual school.
Not positive on that. I don't know. I don't know.
That's what Desi has said. That was the point of these. They're for that town, I believe, is the way it's been. They might have changed.
I don't remember about that. Yeah, maybe it was. I don't remember.
Any other concerns that we haven't addressed yet that people have been raising? I totally understand that it is I think a lot of families we've been hearing from are concerned, period, with the infection rates rising variant, and certainly with given the fact that at least at this time, masking is not going to be required in schools. I think that heightens many parents' concerns about their kids going back. I think, you know, the state would say, and there certainly is a lot of data to show that even in the height of the pandemic, schools were safe and there wasn't significant spreading in the schools, and they have all this, you know, testing and other procedures in place. But I think everybody understands the concerns of families are facing with, particularly since younger kids are not vaccinated, are certainly very understandable.
We have, I think, a few more points that were raised, but Salima also has her hand raised. So I'd like to acknowledge Salima.
Thank you. Julie, I have a question regarding the advocacy of parents when we resume, when school resumes. And, you know, I was under the impression that during the pandemic, we kind of refrained from advocating so much because we were all in that survival mode, you know. But then we're coming back, and we're coming back with students who are really vulnerable in terms of academic loss and social emotional loss and all of that stuff. So what is your advice on balancing the priorities and the needs of our students and our, you know, children versus you know, the sad realities of how schools are trying to equip themselves to face the situation, if that makes sense.
I think certainly I think it makes sense if I'm understanding correctly, but let me know if I'm not quite getting it. I think families, the laws that protect students with disabilities are really strong civil rights laws that are only as good as the paper they're written on, even without a pandemic, right? I mean, there's without active parent participation and advocacy, many of the things that kids are supposed to be getting just don't sadly happen automatically. And I know that during the pandemic, the way, Salima, you were saying, that of course, families had to continue to advocate for your children, but you were also very cognizant and aware of the realities of what districts were dealing with. I think from our perspective, of course, we always want to empathize with and recognize how hard it continues to be for educators, for administrators who are sharing a lot of the same concerns we're all talking about and have their own kids and their own family members. And at the same time, we're in a different posture now. School districts have it's not like it was in the spring of 20 or even the fall of 20. They have had time to figure out how to conduct evaluations, how to conduct IEP meetings remotely, how to do things safely. And there is a huge infusion of federal and state dollars that are flowing into every one of your districts to help them meet the learning loss and the increased mental health needs and the trauma that kids are facing. So my personal 2 cents is that now is absolutely the time, at the same time that you're aware of what everybody is dealing with who are educators, the resources are there in a way they've almost never been. And the need to focus on the recovery needs of kids is very much in the forefront of educators and policymakers. And I think local special needs packs and parent groups can have a huge influence on how all this money is going to be spent at your local level. Every one of your cities and towns and school districts are going to decide how to spend the massive amount of money that's targeted toward the recovery needs of kids. And they need your input to make sure that you know best, the same way you do for your individual IEP meetings, you know best what's needed in terms of recovery. So if you know your school doesn't have counselors, if you know your school doesn't have mental health services that really address the needs of kids with autism or kids with intellectual disabilities, those are things that you can push for as an individual, but also as a group at your local level.
Yeah.
Any thoughts to add to that?
No, it's just, but to this point, it is addressed as well, again, in this new well-being guidance, where they do stress that about the participation from parents, even hearing from students and really getting that input as well as community members. So it's really timely, the question, and it's what the state has already put in.
And on our website, or maybe Lily, you can drop it. We did do a chat specifically around how to file complaints with the state through the problem resolution system. Mm-hmm. And again, I mean, you can certainly let the special ed director know if things don't happen in the next few weeks, you're going to have no choice but to do that, or whatever. There's a way to keep your relationship as solid as possible, but that is an option that families, I certainly need to avail themselves of because the clock is always kicking on your own child, right, while you're waiting for them to get the services they need. So that's an option when you think that that's what's appropriate. When you go to a new district, should we do that one?
Yeah, I was just going to say that's a new question about, which is when you go to a new district with an existing IEP, how long does the new district have to start providing those services that are listed in the IEP? I think that's
so that's a really good question. In the new district, they are supposed to start implementing the IEP in a comparable setting, is what the regulations say, immediately. Mm-hmm. So they have to look at the IEP from the old district and implement it in a comparable setting in the new district. And they have to keep doing that based on the old IEP immediately until they've had time to do their own testing if they want, or they can just reconvene the team without doing their own testing. But until they reconvene the team, it's immediate that they should be implementing the old IEP. Mm-hmm. I don't think anybody can answer the question about, I mean, the doctor, there are many physicians who are recommending masking for everyone. There are certainly a lot of policymakers in our state who are doing that. The Senate president is strongly encouraging the recommendation for masking everyone in schools. That's not where our state is now. It may or may not change by the fall. But there are definitely Salem, and I can't remember, there's a handful of cities and towns who have already decided them on their own that they are going to require masking at all levels in their schools, or in the elementary school levels in their schools.
And it may change by the time of September.
It could change for sure.
Rolls
Many
around.
people would like it to. It's almost 9. Learning language law office. That's a really good point. I mean, I think that is this point about for children who, if masking is required, it's harder to see faces, it's harder to address communication skills and social skills. I mean, these are tough calls in terms of what's in the best interest of children. We know the devastating impact that it's had on kids to be out of school. The state is doing everything they think is appropriate to make sure that schools are fully open and safe, and to balance all these things. There are clear masks. I mean, that's something to push for in your IEP, that your child and the other classmates have clear masks if that's something they need to accommodate their disability, if they're deaf and having hearing impairment, or have social pragmatic needs. But these are they're tough calls. So I think it's there's clearly this was one of the things we were wondering. We have certainly heard concerns about the masks from our helpline. It sounds like that is a big concern for families. The other thing I can say, if there is no mask mandate, and you believe that this is important, you could write to your state senator and your state rep. You can obviously write to your city council, to your mayor. I think this is an issue where, if whatever your position is, I think it's an issue where it is going to make a difference for them to hear from family members and from parents about what their concerns are in terms of your own district's policy or in terms of the state's policy.
Most definitely.
So it is, I think, 9 o'clock. Thank you. I wish more than a year and a half into this, that there were more clear answers to some of these issues, but it is great to hear from you what you're thinking about, what you're focusing on. Please let us know what you think would be most helpful in the chats coming up in the fall. And thank you so much for joining us on this sweltering night. I hope all your kids have as smooth a transition as possible in the fall. I really do.
Thank you.
Thank you.
Thank you very much.
Thank you,
for joining.
guys.
Bye.
Thank you.
Thank you all. I just posted in the chat that you'll all be receiving an email next week with the resources, the slides, and the recording from tonight's chat. So if you missed anything, have no fear, you will get it. And if we didn't get to your question, or if you'd like to discuss something more in depth, we recommend you call our helpline, and I can put that in one more time.
Hello, David Spicer. Fabulous intern we had at MAC, who made a lot of these chats happen in the past.
Great presentation as always. Again.
Thank you.
Hi,
Good to see
David.
you.
Right. Enjoy your evening.
Okay. I'm gonna go turn my fan on while we all.
Yeah.
I'm ripping.
Night, everybody.